Hi everyone, good evening and welcome to a short presentation on Beacon Facebook channel on bone health, right? Today, thank you for joining us for our web seminar, and I'm Dr. Sanjiv Rampal. I'm an orthopedic surgeon here in Kuala Lumpur, and I'm joined today by Dr. Lam Wan Wee, and he's a senior oncologist consultant who has more than 20 years of experience in oncology. And today we'll be talking a little bit more about bone strength and bone problems, dealing with bone strength and also how brittle the bone gets after we age, and also problems associated with bone strength. Osteoporosis is a common underdiagnosed problem that's affecting the Malaysian community. It is basically a problem of bone being wear off or bone that is thinning, and it's caused by the ill management or non-management of bone being produced and bone being broken down. So osteoporosis has many causes. One of the many causes is actually post-cancer treatment. So today, without further ado, I'd like to invite Dr. Lam Wan Wee. A little bit about Dr. Lam Wan Wee. He's a good colleague of mine. He's a clinical oncologist with many years of experience in Hong Kong, in Japan, also domestically in Malaysia. He has worked in Ipoh, in JB, and many centers, and we are privileged to have him here today to talk a little bit about osteoporosis and what we can do to prevent it. As a person who's coming to see a doctor here in Kuala Lumpur, we are often faced with patients who do not know anything about bone health and also about the strength of the bones. So today I thought we expose our patients to a little bit about information about brittle bone disease, and I have my colleague Dr. Lam, and Dr. Lam will be talking to you. We also have translations into English. He'll be speaking mainly in Cantonese. Okay, Dr. Lam, thank you so much.
大家好，我係林醫生 from Beacon Hospital。今日咧，我哋嘅講座係短嘅，講座咧就係話有啲病人嚟到見我哋，有啲叫做骨疏鬆症。骨疏鬆症咧，大多數咧都係骨科睇嘅。不過我啲病人咧係長期有腸患者 cancer， 腸患者好似有黏癌有前列腺腫瘤，佢哋生活咧佢哋可能40歲已經知道有 cancer， 到60、70歲仲係冇事嘅。咁呢啲病人咧係長20-30年咗，佢哋骨疏鬆症咧就比較高啲。咁而家我哋喺別根咧，因為我哋大間醫院咧好多病人嚟見我哋咧，我哋就睇到好多病人有骨疏鬆症。咁係如果病人有骨疏鬆症，有時我哋會睇，有時會骨科睇㗎。咁咩叫骨疏鬆症咧？就係大多數我哋嘅骨就流失咗啦，就比較鬆咗啲。咁你睇啲婆婆上咗年紀70-80歲，佢哋坐前咧唔係直嘅，係駝背咁樣嘅。咁我哋唔想等我哋病人到咁駝背嘅徵象先嚟睇醫生。咁第二樣嘢咧就係 cancer 病人咧，經過有骨疏鬆最多咧就係嗰個有黏癌嗰啲長期嘅啦，腸患者啦，同埋嗰啲有前列腺嘅。咁我哋比較比例嚟咧，我一個病人而家係睇到我大概15年到20年㗎啦。咁佢而家咧就睇我嗰時有黏癌60歲，咁而家嗰個病人已經75歲啦。上幾個禮拜嚟見我嗰陣時咧就話：哎呀，Doctor Lam，我而家開始有骨痛喎，尾龍骨又唔係咁好唔舒服。咁我哋話不如睇下骨科發現到咧做到啲 scan 就唔係 cancer 嚟嘅。因為第一樣我哋最驚呢個病人有嚟翻嚟睇我哋骨痛咧，就係第一有有 cancer 啦。第二咧係咪個骨有咩裂啦？咁我哋做咗大鏡PET scan 做埋抽埋血咧，大多數係冇 cancer 復發嘅徵象。咁做下嗰個叫 bone densitometry 咧，就發現個骨疏鬆症係有。咁個病人咧就睇到我，咁我哋病人話佢話睇到骨科話 Doctor Auntie 你要做手術字先好 ，Auntie 你先上咗年紀啦，哎呀 Doctor 我唔想做手術就嚟又 Covid 我又驚。咁咧我大話咧俾到佢 calcium 丸俾啲骨膠原嘅嘢食咗咧，大概4到6個月。咁都穩定啲啦，咁而家 Covid 少咗啲啦，佢哋話Doctor Lam，我而家肯做啦，咁我咧就叫我同事骨科睇一睇佢咯，咁咧就 而家咧做咗手術咁就好啲。咁好多呢啲病人咧會嚟嘅。咁係如果你係有朋友係有 cancer 嘅，係大概醫咗10幾年㗎啦，咁佢又嚟睇你話，哎呀，我做咩成日骨痛啊、冇力啊？有機會咧唔係有 cancer 復發，有機會都係骨疏鬆症嘅。咁你可以帶嚟畢業跟睇我哋都冇問題嘅嚇。咁如果你有咩疑問，遲啲講座後咧，你可以 call 啊 Beacon 我哋有個團隊會俾你幫你嘅。咁咧有啲病人第一個我哋問咧就係邊種病人係會有骨疏鬆即係收縮多嘅，比較普通人多嘅。咁你會幾樣嘢就係第一咧，佢上咗年紀啦，70、80歲啦，呢種病人做過化療藥水啊，及喺做過電療啦，咁我哋都 confirm 到唔係復發嘅。第二咧，嗰啲病人咧有啲 uncle 咧成日燒煙㗎啦，有啲病人女人都燒煙嘅，不過我哋叫呢啲病人咧就會骨高風險骨疏鬆症。咁呢啲病人飲酒多，佢亦都有㗎。咁有啲病人你睇下骨疏鬆症咧，係嗰啲病人咧成日瞓住張床啊，即係有啲中咗風嗰啲啊，嗰啲病人都會骨疏鬆好犀利喎。咁有時痛骨啊，你都要知道唔係淨係中風影響到骨實啊，亦都有可能骨疏鬆症嘅。咁有啲病人長期食類固醇啊，即係叫 steroid 啊，亦都有機會高啲。咁更年期嘅女人咯，最緊要多㗎咯。咁大多數咧，如果嚟到睇我哋咧骨疏鬆症咧，就係睇骨科嘅。不過咧，我哋 cancer 科咧，大多數病人咧都好多病人嘅。咁佢哋睇我哋咧，如果佢哋骨疏鬆症有咧，我哋係 make sure that 佢哋係冇 cancer 復發。咁樣做啲普通嘅 scan 都唔係啦，咁樣係骨疏鬆症 confirm 到啦，做咗 scan 啦，咁我哋咪傾咯。第一樣做治療服骨疏鬆症咧，就唔係話我俾 calcium 你食，俾硅膠原你食。咁啊，大多數都要同病人傾，你而家有骨疏鬆症，做咩有骨疏鬆症咧？解釋俾你聽啦。第二咧就係食嘢啱唔啱啦。第三咧就係有唔有做運動啦。咁第四咧就係佢有唔有食 calcium 嗰啲嘢啦。咁家族係咪有機會高風險啲㗎啦？咁我哋係會有個時間同病人傾一傾嘅，咁明白到佢做咩有骨疏鬆症，係骨疏鬆危唔危險，犀唔犀利？咁之後佢話啊，doctor我行喺骨科，有啲大多數啲病人上咗年紀又唔係睇咁多醫生，有時短期嘅幾個月頭都係我睇住先嘅。咁我都會同病人講，不如長期睇一睇骨科啊，有可能有啲治療藥丸啊，新嘅藥丸可以俾你食㗎啦。咁個概念咧，骨疏鬆症而家2021就嚟到2022啦。咁咧大多數咧有機會咧係有機會可以做治療嘅。咁大家咧就唔使太擔心。咁咧如果有咩疑問咧，就係可以打俾我哋嘅熱線，喺 Beacon 熱線可以我哋同事咧就會幫到你㗎啦。記住骨疏鬆症係有得醫嘅，不過 make sure that 唔係復發啫，明白冇啊？大家好啦，咁樣拜拜。
So yeah, thank you so much for joining us back again. That was a very informative session with Dr. Lam, and Dr. Lam has talked about a little bit about what is osteoporosis and how can you, what are the high risk groups in osteoporosis and what actually we can do. So now I like to start off with what can we do to prevent problems. Right? Especially if there's a patient who has cancer and we're worried about osteoporosis or brittle bone disease. So prevention is always better than cure, and unfortunately osteoporosis does result in disastrous or a high morbidity or high cost involved in when brittle bone diseases or when bone breaks. Bone usually has a normal activity going on of bone being formed and bone being broken down. So in osteoporosis, there is a disruption of that sequence, and that causes fractures. What are the common fractures that is associated? That's one of the more common questions that usually my patients ask me is, where does the fracture happen and what level, at what bones actually get fractured. So the first bone that's usually been affected is usually the spine. All right, the spine bone. I have a model here with me, and this is a model of a spine. This is from the front, this is from the back, right? So usually they have a compression fracture, or that means it suddenly collapses, and this causes the pain, or because the structures over here hit the nerve, and that's what causes radiating pain down to the limb. So that is the most common fracture that happens in brittle bone disease. The second most common injury that you see in osteoporosis is the fracture of the hip, or what they call the hip joint. And the last one is over the radius or the distal end or the wrist. Yeah, so these are all telltale signs that something is going wrong in the bone health and we need to diagnose it. So that comes to a very nice part of my second part of my topic. What do you do if you think you had previous cancer and you're worried about brittle bone disease? So what you do is you get a simple examination by a doctor, and you need to get a DEXA scan, or what they call as bone scan. A DEXA scan is dense energy X-ray densitometry and absorptiometry, and it's a simple X-ray that's been taken at two different junctions, and that can predict your fracture risk or the level of osteoporosis that you have. So now, how do we prevent it? So how do we prevent it? We have to simply increase our calcium intake in our body. Certain foods have higher content of calcium, things like fortified milk, yogurt, cereals, also salmon, sardines. They are all good sources of calcium. Another thing is that contributes to prevention is maintaining perfect BMI or adequate BMI. You cannot be too big or too small. So when you're too small, you're more likely to have falls and injuries, and if you're too big, the weight of the body actually contributes to a possibility of a fracture. So maintaining ideal weight is good. Second thing is you need to get sunlight or vitamin D. Vitamin D, there's two types. One is readily available, is sunlight. So I usually tell my patients to go for a walk, a weight-bearing walk, or skip rope, or exercises, even staircase exercises, simple weight-bearing exercises in the sun for at least 10 minutes in a day helps with osteoporosis. Another thing would be is maintaining a high diet with increased fresh fruits, vegetables, and whole grains. What else? We have to limit our caffeine when you get older to not more than two cups a day. Also, limiting or reducing the alcohol and cigarette smoking at this age also helps a lot. Besides that, you also have to do some form of balancing and alignment, balancing and stretching of the different body parts, especially the core muscles of the body. This helps with coordination and also fall prevention. Lastly, you need to increase your vitamin D intake. Your vitamin D helps with improve absorption of calcium, and this can be done by eating natural contents of vitamin D. Things like cod liver oil, also essential oils are always important in getting enough vitamin D so that the calcium can be absorbed. I think that'll be the list of preventions. So we always believe here that prevention is better than cure, and we shouldn't be waiting to deal with until the bone breaks, until you see a doctor. So this has been an informative session here with Dr. Sanjiv Rampal, orthopedic surgeon here in KL, and also Dr. Lam Wei Wee, and we will see you very soon in the next session. Thank you very much. Bye bye.